Back to Great Day. Medicare open enrollment ends on December 7th. Just over 2 weeks sounds like a lot of time, but with the holidays, it's easy to forget or give up on, especially when things get confusing. If this is your first time, you need to know your options. If you've enrolled before, pay attention. There are big changes this year, so don't just hit the renew button. Genesis Medical Group cares for the whole family with doctors who specialize in senior care. Farshonda Williams and Megan Craig with Genesis Medical Group can help you find the plan that fits the care that you need. Good morning.
Good morning. Good morning.
All right, first let's lay the foundation for what Genesis Medical Group is, because it's kind of a new way of, or newer way of practicing medicine.
Sure, so we provide care for your entire family, so from pediatrics all the way to geriatrics, right? So the goal is to provide as many services as possible in one place. Yeah. It's like grocery shopping. Do you want to go to 9 stores or do you just want to go to 1?
Yeah, right.
Right? So that's how we practice,
yeah,
is to ensure that we have everything inside for our patient.
It's interesting because some people still have in their mind that when you get sick, you go to the hospital. Right. Well, Genesis Medical Group is like, we want to try to keep you out of the hospital, exactly, right? We want to take care of your health care before then.
Yes.
All right, so you help us manage our health. Any diagnosis can change needs as we need. Mm-hmm. And so let's say somebody has just been diagnosed this year with diabetes. You're going to need some other things. So if you're on Medicare, you need to look at that.
Absolutely, because as we know, the healthcare industry right now is continuously going through changes. So being sure that you're aware of your chronic health conditions that you have now, making sure that your plans meet your needs, and when you need to change those things, that you know what to do and how to get those changes made.
Yeah. Do you have to be a patient at Genesis to get this help?
You do not. You can just call the number. We have insurance specialists available that you can speak to walk you through those steps.
Yeah. I'm surprised though at how many people I ask, do you have a primary care physician? And they'll go, no. So you're signing up for Medicare and you don't even really know what your health is like. This is a good time to find that, find that primary care physician, have your physical, figure out where you stand, right?
Yes, and we will do meet and greets. Come out, come to the clinics, visit us, visit those providers, get to know them,
yeah,
and then be able to use that to make your choice.
Yeah, because you got to consider premiums, out-of-pocket costs, coverage options, all of those things. But again, the focus is also on prevention, so you might not need a lot of those things. Megan, you are a nurse practitioner.
I am a family nurse practitioner.
Yeah, family nurse practitioner, which a lot of people might be confused as to what that is. They just think nurse is kind of an umbrella of a number of practices, right?
Right.
So explain to us what role you play.
So I have the ability to be with patients from the very beginning. I'm a primary care provider, and so I partner with supervising doctors to care for families all the way from birth through geriatrics.
Yeah, and you want to catch things when they're small before they become big.
Correct. And so I like to tell my patients, I want you to come in and see me, not when there's a problem already, but let's be proactive instead of reactive. Are we sometimes reactive? You're coming in for that cold, but let's talk about some other things. How do we keep you from getting sick all the time? Maybe you are a diabetic. Maybe you do have high blood pressure. Those things actually have a severe, significant impact on your overall health.
Yeah.
So let's talk about things now while they're smaller, before they become really big problems.
And by the way, by the time most people are feeling symptoms of something, it's in advanced stages.
Correct.
So you can catch things before then. And again, that whole idea of comprehensive health care all under one group. We talk about your specialists. We're talking about everything. You have the oncologist there. Yes. You have the pediatrics, as we mentioned. You have somebody who deals with autoimmune diseases, arthritis, everything you can think of that you're dealing with.
Yes. Yeah. Every specialty.
Yes.
So I like to tell patients all the time, we are a multi-specialty group.
Yeah.
So not only do we do primary care, but we do across the lifespan in terms of any illness that you're coming in for.
Yeah, and the great thing about that is, let's say you have, I'll go back to diabetes because it's so prevalent in our society. You have diabetes, but God forbid you also are dealing with cancer. Right. You're not dealing with the doctor over here at this hospital over there and treatment over at this other place over here. And so you, under one roof, you all will get together on that one patient. So you have a team.
Correct. Multidisciplinary team of people who come together to really help out. And so I can, with Dr. Ellent, who is the CEO of the group and an oncologist, I can partner with him on a patient that is coming in having cancer and I'm seeing them for their primary care needs.
Yeah.
I can partner with him to be able to really get that patient everything that they need.
Yeah, and that's part of the convenience that you all have. You also have multiple locations.
Yes, and growing. Dr. Ellent our CEO has done a wonderful job of bringing together several different physicians and other healthcare providers from a numerous background of specialties to ensure that we have those access points available for all patients at all times.
Yeah, and if I ask the people right now, where are your healthcare records? Okay, what phase of life and when and where was I living? And they're all, like mine are all over the country. Actually, they're all over the world, right? So this is an option, or the opportunity to also keep everything under one roof, so where you're not having to figure out information, you have it all right there.
Yes, we use one electronic medical record system. Everything from all of our specialists are within one system. Now every hospital, every doctor's office you go to, they all give you a portal. Yeah. So if you have 12 doctors, you have 12 portals. Yep. That's an overwhelming amount of information, and usernames and passwords. Yeah. I don't know my passwords to anything. Yeah. So if I have one place that everything is in, that I can put my one username, my one password, and access to all of my records, it's a beautiful day.
All right, back to Medicare. So if someone's needing help, as you mentioned, they don't have to be a patient, but they can come in and you assign someone that can walk them through it?
Yes, we look at their current needs, the plans that they have right now, and then what's available to them, and also meeting them where they are. You know, what are your costs? Inhibitors, and then what types of benefits do you feel like that you will need going forward? The agents are great at that.
And then letting them know that if a doctor might be out of network or retired, you gotta know that too.
Yes,
you don't want to find out when you're actually trying to make an appointment for something you need to see the doctor for.
Absolutely.
All right, thank you two very much. All right, open enrollment is now through December 7th. For more information on Genesis Medical Group or to find a doctor and book an appointment, call 281-440-5300. Again, that's 281-440-5300. At the very least, find yourself a primary care physician if you don't have one. You can also visit genesisdoctors.com.